Welcome to the CNA eMD documentation course. This is Module 1 and will include 3 modules that will cover documentation to the following flow sheets: the vital signs record, the intake and output record, and the assessment and intervention flow sheet. After you successfully log into eMD, you will need to access your patient's flow sheet for documentation. You will do this by choosing your patient from your current list and single-clicking on their name. You will navigate to the Flow Sheets tab and single-click on this tab. You will then find all the flow sheets that have been loaded for this patient by looking on the left-hand side under Flow Sheet Selection in your Options panel. You can narrow your view by different chart selections, by the date range, and then you will navigate through each flow sheet by clicking on the appropriate flow sheet you want to document to. Before you begin documenting, you must add a time column to document to. To do this, you will access the flow sheet you want to document, right-click up in the gray box at the top of the flow sheet, and choose Add Single Time Column. This means that you want to document now. You will adjust the date and time if necessary, although we do promote real-time documentation, and you should be documenting at the patient's bedside. Once you add your time column, you will see that there is a date and time. You will right-click in this field and choose Edit Text. You must enter CNA in this blank box and choose OK. This will label your time column so that all can see who is documenting for this patient. We will start documentation with a vital sign record flow sheet. After you've added your time column successfully, you will notice that we'll start with the temperature. There are a series of hashtags or number signs in the field by left-clicking next to the field you want to document to. There is a decimal point, so you will enter the temperature with a decimal point. When we choose oral, that is our site, and it is a single click. Moving down into blood pressure, you will enter the non-invasive blood pressure and choose the correct source. So what arm, leg, and so forth. Our respiratory rate is also a numeric value, and our heart rate. If you scroll down, you'll be able to see that you will enter the heart rate, numerical value, and then the method. Was it a device or auscultation? Please don't document to heart sounds. That is a nursing assessment.
If you scroll a little bit farther to the bottom of this flow sheet, you will see an area to document height and weight. This is where you will record your daily weights for your patient. We document only in kilograms, and all scales should be set to record in kilograms. You will then go ahead and obtain the scale that was used to weigh your patient.
You will notice that all your documentation is italicized. You must save the documentation on the right-hand side in order for your documentation to be valid and saved. We will now look at your intake and output record flow sheet. You will access the flow sheet as shown in the prior module by single-clicking once under the flow sheet selection in the Options panel on the Flow Sheet tab. We are choosing the intake and output record, and we will start by adding a single time column as shown prior as well. Right-click, add single time column, correct the date and time, and then right-click in the date and time of the column you created and edit the text. You will type in CNA, click OK, and now you'll have a time column to document to. You will never document in the top 3 rows or the yellow or green columns.
These rows and columns are for auto calculation. Scrolling down to the oral parameter, the liquids parameter will allow you to input anything that the patient has drank. This includes water, juice, tea, coffee, anything that has not been separated out on its own. Your meal percentage is in the quarter percents, and then you will document to the assistants with feeding, whether they're self-assist, partial assist, and so forth. Down into the output area, you will note that there are 2 areas for urine output. Voided mLs is anything we're measuring, and voided count is the patient is voiding on their own or it is a diaper count. If the patient has a Foley catheter, it will have its separate parameter to document to. The same rule applies for the GI area, for mLs and for counts. If the patient has any type of drain, the RN will need to add the appropriate parameter for you so that you can document the output for these drains.
You will then save your documentation. You will notice that it starts to tally for you. In this next screen, you will see that now we have a specified liquid, which is a glucerna shake, and then we will also have a specified GI, which is our drains. Either of these need to be added by your nurse. So if your patient has an extra intake or output measure that you don't see on the flow sheet, please ask the nurse to add it. They are the only ones that have the rights to add new parameters to any flow sheets. The final flow sheet is your assessment and intervention flow sheet. This is what you do and see with the patient. It's very lengthy, but as a CNA, you only have certain areas that you can actually document to. Again, you will choose the correct flow sheet from the left-hand side in your options panel, and you will add a single time column by right-clicking, choosing the correct date and time, and then editing the top of the time column so that we know who's documenting. Once you click OK, there are several parameters, which are the blue headers, that you can document to. The first one we will take a look at is under our safety and falls. And it's actually the interventions. The first one is the WDL for universal falls. This is just an example. WDL means within defined limits. So if you hover over the little blue triangle, you will see a conversation box that tells you what the defined limits are. Your bed in low position, wheels locked, and so forth. You can document that you're applying all interventions. You can also document that they're not all applied and what the exception is, and those exceptions are in the small pick list box below. If your patient is moderate or high-risk falls, the appropriate parameter should be sitting there for you that the nurse has added. So please make sure that you're documenting accordingly. We will never document in the green or any bright yellow. Those are nursing geared parameters. The next area we will document to is under our peripheral neurovascular interventions, which is our anti-embolic interventions such as compression, stockings, or sequentials. So when they're on, you document to them. When they're off, you document that they're off. You don't need to document every time you're in the room.
For the musculoskeletal piece, you will be documenting under the interventions parameter. The nurse will complete a new screen called the Banner Mobility Assessment Tool, or BMAT. Based on this assessment, they will add the appropriate level of intervention, so you will only see levels 1 through 4. You will only document to the parameter that's available. You will document to the interventions, and within this pick list, you're going to be able to document any ROM, position changes, anything that has to do with the safe patient handling plan, and if you have ambulated the patient at all. Make your selections, all of your selections within this field, and click OK. You will also be able to document to any additional equipment used. When you click into this parameter a little bit further down, you will see that you have the option for initiated, discontinued, on or off. And then finally, you will be able to document to any of the toileting that is offered to the patient by clicking into the next field and documenting appropriately from the selection.
Continuing with the assessment and intervention flow sheet, we will start with the skin intervention parameter. Under hygiene care, when you left-click into the column you created, you can document the care you provided to the patient, such as a linen or gown change, a bed bath, partial, complete, bedtime care, and so on. You can also document if it was a one-person assist, if the patient did it, and so forth. There's an oral care parameter. Again, documentation is the same. Single click. Click OK. Turning and positioning. Here you can document to the position and again the assistance level. If the patient can turn themselves, you'll want to make sure that you document this. Anytime a menu opens and you do not need to document in it, just click Cancel and it will take you out of it. We will now talk about assigning a cosigner. You must assign a cosigner when you document in the ANI, not your vital sign or intake and output record. After you document, before you click Save, click on the Save options in your Options panel. You will place a check mark in the square box under cosigner. The next field you will need to search for your cosigner, so your instructor. You'll click on the Other and physically type in your instructor's name. Here we're going to use cosigning nurse. Once you find the correct person, you will click on them and click OK, and you will see their name populate in the field. You will then click the Save button. You will see that your documentation becomes non-italicized, which indicates that your documentation has been saved. Now, in order to unassign, you'll need to take the check mark out of the cosign box and make sure they are not assigned to any other documentation. This concludes the modules for CNA eMD documentation. Please be sure to fill out the validation form for the videos that you have watched. Thank you.